Hey, what's up guys? Dr. Ryan here. This is your adjustment of the week. Today we're talking about hip pain and lower SI joint pain. So this is Casey. She's on our team here at Summit. And I want to show you how I personally deal with hip issues and rotation of the pelvis. A lot of people come in with lower back pain or hip pain. And what I've found out through years of clinical experience, thousands of patients with these types of issues, is a lot of time it's not actually coming from the hip itself or the lower back, it's coming from a rotated pelvis. And in Casey's situation, that's exactly what the case is. So if you look at a spine, just like this from the back, obviously your spine should be straight. And I think you probably realize that when the spine twists out of alignment, when the spine rotates or shifts from one side to another, that can cause pressure or friction on the nerve, and that creates pain. That's called a subluxation. So that's what chiropractors do, is we look for and we correct subluxations. Well, subluxation can actually happen in your pelvis as well. Your pelvis is essentially one giant vertebrae, or at least that's the way we treat it. So when we look at x-rays and we do an analysis through palpation and posture and range of motion, what we're looking for is any kind of rotation in the pelvis. And the pelvis can either rotate from side to side, it can rotate from up and down, or it can rotate front to back. And so in Casey's situation, what we found is that her left pelvic bone, the left SI joint, is rotated backwards and the right side is rotated forward. So essentially it's forward on the right, it's backward on the left. And there's a couple of different ways that you can adjust this back into position in order to take pressure off the nerves, relax the muscles, and alleviate the low back or pelvic pain or even hip pain that you might be having. So one way that we do that is with a drop adjustment. So for a lot of people, this is where we start because it's the least aggressive and it's the easiest on the body. So the way that this works is the pieces of this table come up and down, just like this, and it's kind of loud, so I'll show you and then I'll explain it. Just like that. So the table's kind of loud, but the whole point of the drop piece is that the drop or the table jolts like that. It's called terminal point adjusting, where because of the quick jolt and the abrupt stop in the table, the momentum and the body weight and my pressure continue to adjust the segment back into alignment. So a lot of times, just a few drops is all it takes to get the rotation out of the pelvis. Now, if that doesn't work, or if we don't get the movement that we want to see, then we can do an actual manual side posture adjustment. So that looks like this. Go ahead and face me on your side. Yeah, just like that. You're going to bend this leg up, like so. And then that leg's going to go just like this. And your arms right here. And then I want you to roll your pelvis towards me. Nice job. Feels pretty good, huh? Okay, here, go. You can go ahead and go face down again. So you might have heard that big cavitation, and really all we were doing is the same exact thing. We're trying to take the rotation out of the pelvis. It's just a little bit more aggressive way of doing that, and it creates a little bit more torque. But either way, the whole goal is to get the rotation out of the pelvis to take pressure off of the muscles and the nerves in the lower back, because most of the time that's where the pain is coming from. So I hope that helps you. That's how we deal with lower back and pelvic issues here at Summit. That's your adjustment of the week. This is Dr. Ryan. I'll see you next time.